So it's now my pleasure to hand over to Clinical Associate Professor Wendy Zernike, who's the Bolton Clarke Executive General Manager for Care Quality Innovation, and she's going to give us some closing remarks. Thank you, Wendy.
Thanks, Judy. I'd like to thank all the presenters for sharing their experiences and your expert knowledge around social connection today. I think we all agree that it's very inspiring and your energy is contagious. The first session today provided us with the foundation of why we need to focus on social connection from the perspective of older community members, and that was with Mr. Danny Vadaz. Professor Kath Haslam shared her knowledge on the social identity approach, which explains how the groups that people connect with through social prescribing pathways benefit their health and well-being, especially research around mortality and social connection and better cognitive performance with social group ties. Professor Jane Farmer shared what she'd learnt from her work with the Australian Red Cross and other partners, alongside other evidence that has led to generation of guidance and tools around social connection activation that makes sense and is implementable. The second session built off the session one by exploring the application of evidence into practice. We started with our very own Bolton Clarke-led work with Ms. Kerry Rendell and Dr. Raina Ogren, who spoke about the Connecting Communities to Care social connection program, working with older community members in co-design and for a fit for purpose program to enable access to those who would most benefit. Associate Professor Genevieve Dingle provided tips on how to engage with services, access participants, the timing of assessments, and advice for providers of social connection activities on engagement with university researchers to help with evaluation of their outcomes. Especially those practical solutions like don't use the words loneliness in a program when recruiting and participants, and using positive language. A special mention to Rod McIntosh, who couldn't be here today. And then finally, the panel was a session around how to move social connection activities into business as usual. BAU, including insights from Ending Loneliness Together's Associate Professor Michelle Lim, Alfred Health's Dr. Daniel Feinberg, and Dr. Bogdan Shiva-Carrera from the Global Alliance for Social Prescribing. The panel discussion highlighted, the efforts from the UK government. Social prescribing made policy 2 years ago, and Bogdan, I think the 2,000 link workers is an absolute achievement, and we hope that you get to 4,000 on target. There was also discussion about the hospital-based approach and other issues that can be identified than just medical in a hospital, and using evidence to have discussions with colleagues to reduce the stigma with loneliness, and that this is important alongside the taking of an ECG. So thank you, Daniel. And the importance of a coordinated national strategy and addressing loneliness early affects health outcomes, and that we need to talk about loneliness. We need evidence-based frameworks in our policies, which is absolutely critical, and to encourage link workers to measure loneliness, and this should become the norm. And there was definitely consensus around using the same language around loneliness. And that this too is as exciting as suturing. So I guess it's one voice to unite all sectors. I'd like to thank all of you for attending today and giving up your Friday afternoon. And we've had a variety of people attending today, and this is very much a national symposium, and if not international. We've had attendees from Victoria, New South Wales, ACT, Western Australia, South Australia, Tasmania, and of course across the way in New Zealand and as far as the UK. Definitely a collection of like-minded individuals connecting together, and this was from universities and councils, primary health networks, hospitals, the community sector, peak bodies, community groups, volunteer organisations and Department of Health and Families, amongst others. We're really interested in your feedback on how this symposium has gone today and what we could do to improve, and we would love to hear your suggestions. You'll be sent an email after today with a link to give feedback, and we would really appreciate that. I'd really like to thank the Bolton Clarke Research Institute for putting the symposium together. We really appreciate the hard work that you do and the time that it's taken today, and I think we all agree that it's been a very valuable afternoon. So on that note, I'd like to thank everyone for being here, and for those that are down the eastern seaboard of Australia, keep safe from flooding areas. Thank you.